I'm Destiny Tolliver. I'm a primary care pediatrician and a health services researcher at Boston Medical Center and Boston University. And I was the lead researcher on this study.
And I'm Stephanie Edingur-Cuba. I'm also a health services researcher and an advocate, and I lead a group called Children's Health Watch, which provided the data for this.
So I had previously done a study using national data where we looked at families' participation in programs like SNAP or the Supplemental Nutrition Assistance Program for families who had ever dealt with caregiver incarceration. It can be the incarceration of a parent. We also see it with other family members who are caregivers for young children.
We added questions about incarceration to our survey because it was something that kept coming up both in the policy space and as well as in clinic.
Found high rates of food insecurity, both child and household food insecurity for these families. And when you think about incarceration, I think of a family that if that person was in the household to begin with, they were likely providing income. They were likely helping to provide food for the family. So there's that loss of income, but then there's also increased costs associated with someone being incarcerated. So you have to pay for the bus to get out to wherever they're staying so that you can do visiting hours, or you have to put money in the commissary for them so that they can have some of their basic needs met, or you have to pay for phone calls or things like that. So there's this loss of income and also increase of costs that contributes to food insecurity. I expected things like SNAP, which was one of the more common resources that people had lost. Others that came up were housing and employment. But I think there were other important resources that may not necessarily be at the top of policymakers' minds, things like driver's licenses or other forms of identification. Things like losing the driver's license can be particularly impactful for the whole family because the driver's license can be how someone gets to work. It can be how they get their groceries for the week. It can be how a child gets to their after-school programs, which we know are so important for their well-being.
If we know anything about child development and child health, it's that stability and consistency are vital. And really hard to have consistent nutrition or consistent anything if you're constantly shifting around. So housing is really fundamental, I think. What happens particularly in early childhood is just foundational for good or bad to the rest of a child's life. So it's deeply, deeply concerning that we have so many children that are being separated from their caregivers.
Our immigration system should really think about, like, this person is a caregiver, they are a member of a community, they are here doing work or education or all of these things that benefit our society. But for me as a pediatrician, I, again, care and think most about their connection to children. And because of those things, it is vitally important to not separate them because that is how we keep children safe, healthy, and happy.
We can't care for kids if we don't care for the people caring for them.